This is an exciting time for nutrition. It is unprecedented in the amount of attention, investment, action, and hope for nutrition that we see at the global and country level. The Scaling Up Nutrition or SUN movement, with over 50 countries engaged, is only one example of this attention. The governments in these countries and their development partners have committed to making large reductions in malnutrition in the coming years. Why is nutrition receiving so much attention? It's because malnutrition affects a large proportion of mothers and children. 1/4 of young children are chronically malnourished globally, and 4 in 10 are affected in South Asia and Sub-Saharan Africa. Chronic malnutrition is easily measured. It is the height of young children at a given age when compared to their actual potential. The size of the gap measures the degree of malnutrition. This is called stunting. A common question is, why does it matter? Who cares if our children are a bit shorter than usual? This is a fair question, and there's a compelling answer. It's because there are severe and far-ranging consequences of chronic malnutrition as measured by stunting. The scientific evidence for this has accumulated over several decades and has played a major role in catalyzing the current attention. These consequences include a higher burden of childhood disease and a far greater rate of child death, impaired adult health, and lowered worker productivity and loss in adult income, impaired brain development and cognitive abilities in young children, poor school performance and slower national economic growth. As a result of these consequences, malnutrition is both an outcome and a cause of inequitable development and poverty. So as we can see, chronic malnutrition as measured by stunting is a profound problem with many serious consequences for children, families, communities, and society. And that's why it's receiving so much attention today. What kind of attention is nutrition receiving? It is multi-sectoral, which means action on many fronts. We have known for several decades that malnutrition is the product of problems in many sectors of society. And this is because malnutrition is not just due to lack of food, as is commonly assumed. Rather, there are 3 underlying causes of chronic malnutrition, which we call food, health, and care. The food refers to food security, by which we mean year-round access to the necessary quantity and diversity of foods. The health refers to a healthy environment through improved water and sanitation, as well as access to good quality health care. And the care refers to the proper care and feeding of young children in order that they receive the proper breastfeeding, the diverse foods, the hygiene, and the stimulation they require. Food, health, and care. All 3 are required simultaneously for children to have optimal growth. This is why a multi-sectoral approach is needed. And how is multi-sectoral nutrition to be done in practice? Recently, there's been a convergence of thinking internationally and at country level about the need for both nutrition-specific actions and nutrition-sensitive actions. The nutrition-specific actions usually are done by the ministries of health. This includes providing essential vitamins and minerals to adolescent girls, women, and young children, providing health and nutrition education at facilities and community level, including nutrition in the management of infectious disease, and supplementary or therapeutic feeding when needed. Those actions need to continue, coverage needs to be expanded, especially to the hard to reach, and there needs to be constant attention to the quality with which these are delivered. In addition to actions in the health sector, we also need nutrition-sensitive actions in other sectors. A sector can become nutrition-sensitive by ensuring that its current programs and policies are consistent with nutrition goals, and sometimes by adding new interventions or programs. For instance, in the agricultural sector, there should be a proper balance between the promotion of staple crops and the promotion of nutrient-rich vegetables, fruits, and animal-source foods. And attention is needed to ensure that low-income households have access to these foods from markets or their own production. The education sector can become nutrition sensitive by developing or expanding a school health and nutrition program, or school gardens, and by ensuring nutrition-relevant curricula at primary, secondary, and tertiary levels. Social protection programs can become nutrition sensitive by ensuring the eligibility criteria and the package of services is appropriate for pregnant and lactating women. Gender is of central importance to nutrition, and as such, all sectors should strive to become gender and nutrition sensitive at the same time. Water and sanitation programs are inherently nutrition sensitive but can become even more so by forging integration with the actions in other sectors, by giving due attention to hygiene practices in addition to infrastructure, and by ensuring appropriate services in schools and health facilities. Trade and industry play key roles in regulating or influencing food supplies, food prices, and food security, and they have special roles to play in food fortification and other quality standards. And finally, the Ministries of Economics and Finance can ensure sustained and adequate financing for the nutrition efforts in all sectors.